Okay, good.
Okay, so I'm going to show you guys how to set up a fluid bag and line to give a Cytarabine CRI. So with that, you are going to need your fluid bag. This is just an example that I'm using, whatever fluid bag your doc wants. You will need one of the C100 fluid adapter spikes, one of the Phaseal infusion adapters, and then one of the little white connector ports that will be attached to the patient's IV catheter. So when you are setting this up, first thing you want to do is spike your bag with this adapter. Spikes just like any normal fluid line would, just like that. And then before you put any drug into this, you want to take your fluid line and spike it into the adapter. So this little guy just pulls off there. Spikes again, just like a normal fluid bag, so you just got an extra piece in there. And then you want to go ahead and prime your line prior to putting any drug in. That way you're not exposing yourself to any of the drug as you are mixing it and hooking everything up. So just go ahead and flow that all the way through so your line doesn't have any air bubbles in it. And then you can just clamp it off at any point on the line. And here is where you want to take the injection adapter. There we go. And attach it to the line. So then we have a very nice closed system there. And so now you are ready to add in your Cytarabine to the bag. So we're just going to pretend this is my syringe that I already drew up my Cytarabine in. And all you're going to do, it attaches into that side port and you will just inject it in. This is a one-way port, so it will go into the bag and not down through your line. So inject your Cytarabine into that. You can give it a couple mixes, and then you are ready to go and attach this to the patient. Again, you're going to attach the little adapter here to the end of their T-port. That is not to be removed, and you need to make sure that the ICU staff who may be taking care of this patient are aware of how to use the Phaseal system. So we want this to be an entirely closed system while this is being administered to the patient.